Okay.
Yeah, exactly. Okay, so
Okay.
you can hear me okay? I'm going to start
Yeah.
recording again. We'll just start over again.
Okay.
All right. Hi, Jessica. I'm so excited to have you on today.
Hi, Nancy. It's nice to be here.
So, this is actually a really special episode for me. I'm really excited to have you on because most of the time I will interview people who are strangers to me. I maybe have read about them online, but I've never met them in person. But you and I are actually good friends in real life. And another funny, quirky thing was that we discovered after moving here to Portland that, and we met here in Portland. I'm going to start over again. I'm totally messing that up.
If you don't like my
I'm messing
response,
up.
I'll also
No,
re-record
it's
it
okay.
too.
I'm like messing up more with you than I'd like normally do. Go
Am I
figure.
distracting?
I'm like, hey, it's Jessica. Okay, let's start again. All right. Okay. Hi, Jessica. Thank you so much for being on with me today.
Hi, Nancy. Thanks for having me.
So, I'm really excited to have you on the podcast because most of the time I interview people who I admire from afar and I've not met them before, but we actually know each other and we're friends. And so, this is kind of a neat experience to be able to interview one of my good friends.
And this is my
Um,
first podcast, so this is a new experience for me.
Perfect. Perfect. And so I mentioned that you were essentially born and raised in LA. You're now in practice in Portland as a urologist. We met here in Portland, and it was just this crazy, strange coincidence that we discovered we grew up in the same little enclave in LA. It's kind of small, no one ever knows where it is, Hacienda Heights.
Even people in LA don't know where Hacienda Heights is.
Pretty much. They're like, where is that? So yeah, usually no one even knows where it is. So I was like, you're from where? But just a funny coincidence. The world ends up being pretty small. So you are not just a surgeon, a urologist, you're also a mom and a wife, and you're also an entrepreneur. Obviously, you kind of wear a lot of hats. What was your upbringing like, and who were your influences growing up to shape you into who you are today?
Well, I don't ever consider myself in sort of the leadership role just because I grew up always the younger sister. So in all Chinese families, all the praise and all the expectation is bestowed upon number one. And number two, you're supposed to continue to support number one. And so I feel like in my life, I've always followed my older sister. And granted, we're only 14 months apart. But I do feel like that it did give me a little bit of a chip on my shoulder in the sense that, everyone expected a lot of her. I had this little chip on my shoulder to think, well, I could do it too. If she could do it, I could do it. So I always wanted to try to one up my sister just because she was so good at everything. She was always top of her class. She was always well liked by her teachers and everything else. And so whenever whenever I went up through school, I was always, oh, you were Melissa's little sister. You're Melissa's little sister. And so growing up, I always got a chip on my shoulder that I had to be different from her. And so my sister actually always wanted to be a doctor from the time she was little. That's what she wanted to be. That's what she felt deep in her heart. That's what she always wanted to do. We do have some doctors in my family, and these are the people I've always looked up to growing up. So my uncle is a neurosurgeon, and he's basically like my second dad. My grandpa was a pediatrician. My aunt was an anesthesiologist, and my mom was not a doctor, but her initials were MD. So she always said she was a family doctor. So there were a lot of doctor influences in our life. And so since my sister wanted to be a doctor, I absolutely, positively did not want to become a doctor. So, so I
So
made it
what
my
happened?
point in
Because
life.
clearly you're a doctor.
I know. So I wanted to be everything my sister was not. It's kind of interesting, kind of the route that I got there. When went to college, I was actually an econ major, and I really thought I was going to do the finance route. I was going to be work on Wall Street and make a ton of money, and um, I felt like that's where everyone was going at that time. And I guess what sort of happened was, um, it was my junior year, and I was applying to all these um, investment banks for internships, where that's what you did at the time. You applied for an internship, and you hope they offer you a job for the following year. And so I was applying for all these internships, and so you go to dinner, you meet all these people, and I just did not I felt like I did not like the lifestyle that it introduced. There was something really superficial about it all, I guess. Not that I think it's not worthwhile, not that I think people in it are superficial, but there was something, um, there was something I felt missing in, the work is really interesting. The type of what they're trying to achieve is really interesting, but something felt very hollow to me about going into it. And so I remember having a talk with my uncle about this, and like I couldn't reconcile like what I was this empty feeling that I was feeling. And um, I guess when I was talking to him, I said, we were talking about, at the end of your life, what are you going to say that you are proud of that you've done? And I said, if I really pursue this career, I'm not going to know what I really have shown for it at the end of my life. Like I may be really wealthy, and if that's the end goal, then maybe I would have achieved the goal. But I can't say that I would be really proud of myself for just being wealthy and making a lot of rich people richer, even though that's a very worthwhile endeavor. and so him talking to me, he said, the older you get, when you're at his point in his life, he said that feeling becomes ever more important. That feeling is only going to grow in you, and that's going to matter more to you the older you get and the closer to the end of the career you become. And I remember he said, listen to that feeling and just start looking to other things. And so since I spent a lot of my summers in Oregon, he never really pushed it. My family never pushed medicine, but he said, take a look at medicine. We've always really liked it. And so I shadowed an allergist, an anesthesiologist. I shadowed a radiation oncologist. My aunt took me to the OR with her. They stayed up really late. We did for that, and then woke up really early. And that day I actually almost passed out in the when I was shadowing with my aunt. And so she actually found out that I was lying down in the lounge, and she came in and was like, what is wrong with you? Get up. Like, you are weak. Maybe you aren't cut out for this.
Zero slack for you.
I was like, well, we did sleep last night, and here we are. I feel a little nauseous, but
despite that.
Yeah, and then I think, at the time I just was like, well, I might as well just take the MCATs and see what happens. And so then I took the MCATs, and I did really well on it. I was like, well, maybe this is a sign. Maybe I should go to med school. And then I thought, well, maybe I rejected medicine so long, my whole life, because I didn't want to do what my sister did. And so, but maybe the right path is, maybe she did point out the right path. And so there I go, following in her footsteps.
You're like, darn it.
I know. Yeah.
So you went to medical school, and at what point did you decide on what you were going to do? And as you know, I named this podcast the 6%, and I talk to a lot of women who are in traditionally male-dominated fields, and urology isn't exactly 6%, but it's pretty low as far
Mhm.
as number of females. How did you decide to go into urology?
Well, nobody ever enters med school dreaming about becoming a urologist.
They might be out there.
There may be a couple pervs out there like that. But no, I don't think anyone ever dreams about going into urology. It was interesting that the first lab that I worked in was in a lab of a urologist. And it just happened, and it ended up being it was a very, not a very clinical lab. It was a bench lab, looking at, I don't even remember what we were looking at, apoptosis and some sort of culture, but it was the lab, the PI was a urologist. And at that time, it didn't really give me any exposure clinically to urology, but but I happened to meet some of the urologists as a result of this lab.
And were you like, these are my people?
No, not at all.
Oh, and by the way, there are non-medical people listening. So like PI means
Oh
principal
yeah,
investigator, right? So
sorry.
this is the boss researcher. So you did not meet them and say, you are
Oh,
my people.
absolutely. No,
I will join you.
I picked the lab because it sounded like he had a project for me that was completable in a summer. And
Mm-hmm.
so it just seemed like it was a good scope of research for a summer project. You know, it wasn't just, oh, here, you're going to pipette and help us finish our studies. It was, oh, here, this is what you could actually help us investigate.
Mm-hmm.
And so I thought that was, for me, it was more the experience in a lab rather than the actual, whatever I was actually researching. And then when I first started med school, I wanted to become a plastic surgeon.
Mm-hmm.
And so the head of plastic surgery at my medical school was Susan McKinnon, who is this badass surgeon mom. She had 4 kids. She was the chairwoman of the department. Um, and she gave this medical school presentation that was just amazing. She did peripheral nerve um, surgery. And so she showed all these remarkable regenerative procedures. So, you know, she did these nerve transfers and made these arms move again. And I looked at her and I was like, I want to be you. Like, whoever you are, I want to be you. And so I actually spent 2 summers, you know, working in her lab. Um, and so I really thought I was going to go into plastic surgery. My husband actually worked with a urologist in med school and wrote a paper. He thought he was going into cardiothoracic surgery, so he actually wrote a paper with a urologist talking about one of these renal cell carcinomas, how they go into the chest. And so he wrote a paper about that. So he actually, as a result, met a lot of urologists through his research. But, you know, as you go through med school, it's hard to say what actually influences you. A lot of it, I think, is the people you meet along the way, who you're drawn to, who has the same sort of humor as you.
Yeah.
And so, you know, part of it is I felt like I did tend towards surgery, and I like the surgical subspecialties. And so of the surgical subspecialty, or of the surgical specialties that seem to have a, you know, that had a sort of a balance with a life, you know, it was like ortho and urology, ENT, and plastics,
Mm-hmm.
basically. And so it was sort of a process of elimination from there.
Uh-huh.
But I think mostly is the people that influenced me, the people that I met who thought that I felt like I could get along well with were urologists. But, you know, imagine my mother's disappointment when she found out. Like, so
You're
funny.
not going to be a plastic surgeon.
And you're going to be a what? Her response was literally, what am I going to tell people you do?
Well, Mom.
Well, you could tell them I'm a doctor. You just leave it at that.
Oh,
Who's
so
gonna
much
do
of this is
yeah.
so much of this like it just goes back, especially as Chinese Americans. It's like it
Oh
goes
yeah.
back to parental disappointment.
Yeah, absolutely. And I mean,
Uh,
and I'm in this area where, it's you can't talk about it either,
right.
you know?
Yeah, I'm sure by now she's gotten over it a little bit. Does
Yeah.
she still feel weird about telling people what you do?
I think she realizes that the scope of urology is so much greater than she perceived,
Yeah,
you know?
I'm sure she just thought it was like penises all the time.
And prostates and
Yeah.
yeah, but I don't think she realized, kidneys were involved and
Yeah.
tubes. It's not all genitalia, you know?
Yeah. I think the
Uh,
general public a lot of times they don't realize how much more there is to the whole
yeah, the
system, the
urinary
GU
tract, yeah.
system. Yeah. So while we're on the topic, let's talk about pee. Um, you you seem to be fascinated with pee and how to keep it from ruining our lives.
Yeah.
And so I really
To
want
get the pee in and to get the pee out, to keep it to stay in and come
yes.
out. That's my
It's got to
job.
behave, right? It'll
Yes.
stay in when you want it to stay in,
Stay
come
in.
out when you want it to come out. And
It's
so
and that's so tricky sometimes.
it is not that easy. It's not just like turning a spigot, right?
No, that would be so much easier.
It really would. Imagine like if you had a little spigot or a button that you could just press and be like, I'm going to pee. Shh, I'm going to stop, let it go. So like our bodies don't actually do that. And a lot of times for women and men, but women after childbirth, they may spend their entire younger adult years never even thinking about incontinence, and all of a sudden they have a baby and then they're just like, oh my gosh, I'm leaking. um, Tell me a little bit about how this inspired your entrepreneurial pursuits.
Well, I really started thinking about it when I was pregnant with my first. And, when you're on maternity leave, you have a lot of time with a crying baby to think about things and ruminate on the world. But when after you have a baby, there's this 6-week period where you have this incredible period for 6 weeks. Also, I had a really tough pregnancy, really tough delivery. And I remember one day, this is how much sharing can we do here?
Dude, share away. I like your deepest, darkest secrets. And it's only like, think about it this way. It's just me and you and whoever listens to this, because it'll be an Apple podcast. So yeah, share away.
But I remember one day, I had put on like 60 pounds during my pregnancy, and I was just peeing a ton after I delivered my first. And in this period where things are still numb, you don't quite know, you're sitting on a bunch of pillows. I wasn't sure if it was me or all the padding that I was sitting on, because my labia were the size of pillows because I pushed for 3 hours. Everything was so swollen down there. I really felt like I was sitting on cushions for 2 weeks.
Oh my gosh. Now,
And
I bet a lot of our male listeners are like, what is happening here? But, I think women who have gone through childbirth and vaginal delivery kind of know exactly what's going on. Ali Wong talks about this. I think she calls them meat curtains.
Yeah. But you can't believe how big they can become. And you think to yourself, wow, will they ever even as a doctor, it's like, wow, I don't think I've ever seen them so big in anyone ever. Like those are the biggest I've ever
Lucky
seen.
you.
And I remember at one point I went pee, or I had to go to the bathroom, and I had taken this big wad of stuff that they had stuffed under me down, and I looked in and it was heavy and wet. And I was like, wow, that's all pee. Like, am I totally incontinent now? Like, I didn't even feel it. I had no idea I was peeing myself the whole time. And so my husband had come in, and I said, before we go home, can
Hold
you
this, feel this.
I
It's
said,
so heavy.
could you just make sure you buy, because I have a lot coming, I have a lot going on right now. Can you just go buy the biggest overnight pads that you could find, like the thickest, heaviest, longest overnight pads you can find? And he said yes. And my husband always takes all his tasks very seriously. And so he came back into, when he had done his trip, he came back in, he was like, I'm genius. Look at what I bought. And he held up Depends. Like, literally, he was like, look, you don't even have to worry about it. Just put on these Depends. It'll catch everything. And I looked at it and I was like, oh my God, you're right. I am 32, but I am totally incontinent. Like, I'm gonna have to wear Depends the rest of my life. And I just started sobbing. I mean, you just have a baby, or you got these meat curtains, you're incontinent, and it's like, yes, to add insult to injury, give me, like, just hand me over the Depends now. And I don't know what happened to those Depends. I never wore them. I never saw them again.
Mm-hmm.
They just disappeared. And I just remember the look on his face was like, oh no, totally the wrong product right now. Totally the wrong. And so, there was so much shame in it for me at that point. It was so embarrassing. And then, from a physician standpoint, I deal with incontinence all the time. And it's not just the cough, laugh, sneeze type. There are certain kinds of leakage, spinal cord issues, and um, urge incontinence. Or, there's a lot of incontinence we can treat and help. And there are certain ones that our options are really quite limited. And there are also times when somebody's incontinence is really mild. Actually, from a physician standpoint, you think, wow, I mean, that does not sound very bad. And you're going to go through injections and medications and surgery for this. It doesn't seem like that this is so much bother, because we also deal with cancer and everything else. And it seems, on the scale of things, well, um, not to trivialize it at all, but there are times where, I mean, there are obviously times where it's terrible, but there are also times where it's just really doesn't seem that bad. And so you think, like, what is it about this problem that people are willing to do so much, even when it's so minor, even if
Mm-hmm.
the amount is so minimal? Like, some people are willing to have surgery and they don't even wear a pad. Like, they don't even leak enough where they wear a liner. Or some people are not willing to ever wear a liner, even if they have to change their own clothes. They're like, I'm not ready to wear a liner, so I just
It's just
change
so
my
much
clothes.
stigma attached to that.
Yeah, exactly, just
People
the
can't get over
stigma.
it.
Yeah.
Yeah.
And so it just seemed like, well, what is it about the incontinence that gives people that stigma? And it's, so when I thought about it, is, when they're in the locker room, they don't want to pull down and they have this paper diaper on, or, they just want to look the same, feel the same. They're afraid that they're that old person that smells like pee. And so, it just seemed like a solvable problem. And at the time, when I was with my newborn, I thought, oh, I want to be the super eco-friendly. I don't want her diapers to be filling up our our landfills. So I had researched all these different diapering cloth diapering systems to try to get cloth diapering down. And so at the time I was like, well, why isn't there something super cute like this for adults? I mean,
Mm-hmm.
clearly the technology is here. These kids pee through these diapers like crazy. There's got to be, and these diapers hold so much. There's got to be the adult equivalent. And at the time, there was nothing like that. So I thought, well, I mean, the technology has got to be there. I don't have to reinvent the wheel. I just need to sort of repurpose these ideas and make it more presentable and acceptable in adult form.
Right, because a lot of times after having a kid, many moms want to try to get back into shape and
Right.
they want to go to the gym. And so if this incontinence is continuing and they're leaking, like you were saying, they don't really want to be seen with a bulky pad. And it seems like it could be a strong enough deterrent that maybe
Yes.
some of these women wouldn't even go.
Yeah, and you can't wear the cute clothes. You can't wear the tight Lululemon pants because you're
Hmm.
gonna. Those are the ones that you're gonna show through.
Yeah,
Um,
and it's not like that is like the be all end all is to like get into your cute yoga clothes, but I feel like a lot of times after childbirth, a lot of what women struggle with and work on is just kind of a reclaiming of their body and
yeah.
finding things that they look good in and that they feel good in because they feel like they look good, and so
But
it's
I also
it.
feel like there's so much expectation with Pinterest, and there's so much placed on moms now. You're
Mhm.
expected to throw the perfect birthday party with the right cookies, everything
Right.
has to be Instagrammable. Your life
Mhm.
has to be Instagrammable. And so nowhere in this life that you've pictured yourself in is
Is
this
peeing everywhere?
problem. Yeah, exactly. It kind of, I do think that, with all these you're supposed to be the perfect wife. You're supposed to be the perfect mom, and you look online and it seems like all these women are doing it. They've got their careers, they've got their families, and yet they can still put out this beautiful dinner every night, and their houses are perfect. And so I don't know that I feel like that's just so not real life. And I feel like a lot of times we just have to give ourselves a break. Like,
Yeah.
this is just too much.
Right.
And
Because,
like,
no one's ever actually sharing on their Facebook their yeah, that
pee.
was a Freudian that was a Freudian slip. Facebook feed
Uh-huh.
that like, "Hey everybody, happy Saturday. I just peed my pants." No one
Yeah.
like people aren't posting that, right? So like
Unless
if they
unless you're
actually
unless you're my friends and then they send all the pictures to me.
yes, it's like, "Jessica, just want to let you know I peed my pants again. When's your
Yeah.
product coming out?"
But that's the incredible part about this, I think, is how, yeah, I feel like it's sort of the same thing that I experienced with infertility. When we first had fertility issues, um, we were sort of embarrassed to talk about it. We never talked
Mhm.
about it. And then one day we were just like, well, fuck it. This is so exhausting. And so we just openly said, oh, yeah, we did IVF. And the amazing part is when the moment you start talking about it, you realize, wow, almost all my friends also did IVF. Like almost everyone did. And
Mhm.
so I feel like it's one of those things that's just not, it's kind of taboo and it's not talked about. And so when I started talking to my friends about, and while I see a lot of patients with these issues, none of my friends really talked about it. And the moment I said, "Oh, I'm making this underwear for people who pee themselves," everyone, oh, half of,
Hallelujah.
yeah, all
Everybody
my
was like,
mom friends are like, "Oh,
"Hallelujah."
I'll try it."
I'll
And so
test it for you.
yeah, it's almost the person that says, "Wait, why do you need this?" is almost the rarity. It's almost
Yeah.
I almost feel like I don't have to explain it because the person who doesn't get it, I guess, in my realm is so rare that it's almost unnecessary to explain. But
Right.
no,
Because
but
I think as soon as you say, hey, I am designing like this high tech, cute, but super functional underwear slash thong for in case you pee yourself when you're working out or just walking around. Like, I mean, like so many of your mom friends are like, hell yes, I need that,
yes,
you know?
yeah,
Yeah, it's one of those things that, you know, no one has really tapped into that and really designed something that fits both the form and the function, right?
you're right. And I feel like as when you're a mom too, you also participate in activities that you haven't done since you were a kid. Like when was the last
Monkey
time
bars.
monkey bars, you jump on a trampoline? Who jumps on a trampoline, right? I remember in residency, I would be interviewing these women and it's like, oh, just when it only happens when I'm jumping on the trampoline. And it's like, why are you always jumping on the trampoline? And then you have a kid and you're like, oh, yes, there is a
Right.
lot of jumping involved in
Yeah.
running after a kid. And
Yeah.
you're
And
like, oh, wow, you do need another level of continence to jump on a
yeah,
trampoline.
and it's true. And and also I think part of being a mom with a young child is almost rediscovering those things that you used to do carefree as a
Mm-hmm.
child, and that, you know, you get into adulthood and you're like, well, I don't really, you know, have dance parties in the living room anymore. I don't know, some adults do. I actually don't think I ever
Wait, you
stopped doing
don't?
that,
Yeah,
but
I was like,
no, I think
wait,
I pretty
I'm
much
pretty sure
continued
you
to.
do.
Yeah. Before children, after children. But I mean, most people kind of let go of their
Uh-huh.
fun loving self, and when they have a small child, it brings that back out. And so it's kind of a shame if you can't participate in that
Yeah,
because of the
exactly.
incontinence. So I think that what you're creating is just going to be so well loved, and then women are going to be like, "Oh my god, that's cute too." So that's exciting.
I hope so. I wear it all the time. So in the end, I'll
Yeah,
have a lot of underwear.
that's awesome. So you're a general urologist, right?
Mhm.
And you are in private practice. What do you think in your path to becoming a surgeon and in a field where there really aren't that many women? What do you think were some of the challenges that you had being female?
There have been a lot of challenges. I guess hold on, can you pause for a sec, I guess?
Yeah,
Oh,
yeah,
can you
that's
could
fine.
you could cut it out, right? So
We
if
just
I
cut
like
it out. Yeah,
okay,
we'll
you
just
could just
edit
cut it
it.
out.
Uh-huh.
Okay. I mean, I guess there are challenges on so many different levels. I think at every step you have, things that are unique for women being in, like, even just being a woman in a surgical subspecialty. You know, I think, for instance, I'm sure you experienced this. I went to a pretty old school residency program, and I think it goes both ways. I think sometimes you experience the people don't expect as much of you, or they think they want to see how far you really are, how much you really have in you, and
Mhm.
so they'll make things a little bit more challenging for you just to kind of see what kind of guts you truly have.
Mhm.
And I think sometimes you get cut some slack because they don't know how to handle you because they've never had to deal with a woman. And
Right.
so they don't know if they need to be extra gentle, extra careful or not. um as a med student, I remember my chairman saying um something to me. I remember I had just gotten engaged, and he would say something like, "Man, your fiance has to be really confident in himself because when you go home at night, you're gonna think, man, he is the man,' or you think, oh no, he is not the man. He is not." So he's got to be super confident in himself, or, there are also these, and I don't know if this is unique to being a woman, but there are times where, the field is so small, even if there's a little bit of a harassment, no matter what it is, you can't really talk about it. You have to be one of the boys, right? There's
Mhm.
something really offensive being said, but they kind of look to you like, but you're okay with this because you're one of the boys, right? um, I remember an attending would when he would operate laparoscopically, there you have a lot of long instruments, and so
Mhm.
he'd be like, "Oh, you're touching my shaft, you're stroking my shaft," and he would make all these
That's
innuendos.
like so inappropriate,
So
but
inappropriate, right?
obviously this happens.
But it happens. But if depends on where you are in your
Mhm.
cycle. um you may or may not be able to say something. It's a really small
Right,
world. The moment you say,
right,
oh, this was complete harassment, you would you're gonna get blackballed because
right.
everybody knows.
Pun intended, not
Yeah.
not intended.
They're gonna say you're the one that can't
Yeah.
handle it. You're kind of a
There's
complainer.
the fear of
That
that. Yeah. So,
exactly,
I mean,
definitely.
if you're a med student trying to get into residency, or even you're still a junior resident, it's like it's hard to know when it's okay to actually say something, and that
Exactly.
you won't feel the negative consequences as a result of speaking up. And
But
I don't know.
when it's such a small, there's only a few hundred spots, you're not,
Mhm.
or a few hundred programs, and they all know each other. There's no way that that's not going to get around,
Right.
if you make a complaint like that. But
I think there has to be, it's very hard when you're the student or you're a trainee to have the courage to say anything. But I think that other people standing by it's never you and the attending in
oh
the
yeah, no,
OR.
never.
There's the scrub who's scrubbed in with you. There's the OR nurse. There's the anesthesiologist. And I think that culturally, it is up to other people around to recognize that, hey, this student's probably not going to say anything, and so it's up to other people to call it out and say that this behavior and that this kind of talk is not okay. This is actually not okay, because you can't expect the medical student to just be on her own
Yeah.
to be able to say, you can't talk to me like that, because that, for better or worse, for worse or worse, like that could be the end of this person's,
For sure. It would be the
career. Or
end. It would
yeah,
absolutely be the end.
yeah, kind of depending
I
where you are, most places, that
um
could be it.
but even as you advance through your career, um you know when I was in a resident, I love my residency program. Yeah, for most of the time I was one of 16 residents. There were only two of us that were female. And for the most part, I had the best chairman in the world. I felt very supported for the most part. But there are little things, like, we were trying to have a baby then, and half of my co-residents had their wives pregnant. But they would come up to you and they would say, well, don't stand too close to these guys because you might get pregnant. And it's like, oh, all the men are allowed to have children, but the women are
Hmm.
not.
Right.
I see how it is. And it's
Hmm.
like, oh, I've been married for 5 years, so either I don't want kids, which that'd be an annoying comment, or
Hmm.
I've been trying and I can't, which that would be an annoying comment. Like,
Right. I mean, it's
this
just
would be
people say the
enough.
most ridiculous things,
Yeah,
right? Like
absolutely.
it's obnoxious even in its own right. It's like,
Yeah.
how dare you talk about whether or not I have a kid? And 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 they're probably joking, but it's just incredibly insensitive if it's somebody who's going through infertility. I
Yeah.
mean, it's heartbreaking. Or
Yeah.
like, you just never know if a woman had like been trying and she just lost a baby.
Yeah.
You can't, you
But
just can't
with,
say that kind of stuff.
being in such a small program, there were only 16 of us. If one of us were out, it would be a huge burden on
Yeah.
the others. And so, there was one girl who who was pregnant during her training, and she was back to work in 2 weeks.
Wow.
She was always set as the example of the true strength in women. Like, this girl got back in 2 weeks. If you ever got pregnant, well, this for so and so did it in 2 weeks.
You should
So
be able to be back in 2 weeks
yeah.
with your meat curtains. You could be like, okay, I'll come back to work, but what do you want me to do with these meat curtains?
I
I'm going to have
know.
to drag with
I
me to
know.
work. Yeah.
But
So,
then, and then, and then when you get you would think you're like, once you're in a more position of power, you think you'd be beyond that kind of, you always think, oh, I'm going to be the one that stands up for it. I'm not going to be the one that takes it. And then you realize it's still not that easy. There's always
mhm.
going to be things in your way. So, we can go into the drama of trying to be the first person on maternity leave in my private practice. And, that was a challenging situation. But I think I do think that women in, medicine is really backwards, especially private practice when you're, the owner and you're supposed to be the one writing the rules for you. But if you're the only one, if you're one vote in 9, you can't get very far. But I feel like I'm also in a unique position just to see how, how the government values it or doesn't value the treatment of women, because I treat both men and women. And so, um, I do see how, like, a lot of times people will say, oh, women make less because they don't work as hard. They want to stay at home and watch their babies, and so they just don't work. They work part-time, and this is why they don't earn as much. But in my position, I can actually see that the reimbursements are totally different for
Mhm.
female conditions versus male conditions. So,
Yeah.
I would have to put in 7 slings to, do to make the same amount of money or get the same reimbursement as doing one simple office procedure for the prostate, for instance.
Mhm.
So
So it's even devalued
it's
on the
devalued.
insurer's side.
Yep, exactly. So so if you predominantly treat women, people will say, well, you're not working as hard, but
You have to work
you're
harder
you have
to
to work
make the
harder because
same as,
because
yeah.
each unit of work is valued less because you're doing it in women. And
Mhm.
so,
It
and so,
encourages the negligence of women in practice, I think.
yeah,
I think it just puts female patients at a disadvantage because,
exactly.
any private practice is going to want to make sure they're generating enough income to cover their overhead. And if it pays that much less, a seventh or whatever,
Yeah,
to take care of a woman, why would they want to take care of women patients?
right,
And I think you've related this to me in the past too. Sometimes women want to see other women as
right,
their physicians,
right,
and so, a lot of times you may get more women as a result of that, and
right.
that, there's
But
kind
then
of that
also,
pathway that exists.
yeah, and then that could always be used as a justification, to distribute more of the, lesser pain, for
Yeah,
instance, patients to you, just to say, well, these are women that want to see women. And
yeah,
so we men are not going to see them because they're not going to like us. So they all, preferentially want to see you. These are all time consuming and don't, bill very much for these visits. So we're going to dump them all on you because they all want to see you. And so you could be working your butt off, but they'll say,
hmm,
but look, your work, you haven't generated very much work because you haven't billed very much.
Right.
And so ergo, you must not be working very hard. And therefore, and so I feel like a lot of women are devalued that way just because
Mm-hmm.
there are inherent things built into the system that will devalue your work and what you contribute. So I think those are things that are challenging, um, from like a business perspective, I guess.
Mm-hmm.
But
So, I think that with all these challenges that you can experience going into a male-dominated field, there had to have been times either in your urology career or even in your entrepreneurial pursuits where you just got so frustrated that you said, "Oh my gosh, I just can't do this. I want to quit." Has that
yeah.
happened to you?
Oh,
And like,
absolutely.
what made you keep going?
Oh, absolutely. There are so many times, on one hand, I feel like part of the reason why I did go into urology was because there were so few women. And at the time, I thought, well, there's definitely a need. It'll be much easier to, it seems like a much unserved population.
Mm-hmm.
Um, so, when I finish, I'll be much more in demand because there's so fewer, you're just going to be a rare commodity. And there's certain value, things that you'll bring to the table that is not easily just um, obtainable elsewhere. So
Mm-hmm.
that's probably part of the reason why I went into it. I actually remember looking at numbers like, oh, there was a huge shortage. They thought like the ideal number was one urologist per 40,000 in the population. And when I was graduating, the number was like 1 in 70,000. So I was like, oh, they need urologists out there. And at the time before I went into, there were only 400 board certified women in
Mm.
urology. There were 400 in training, but there were only 400 in practice. So I was like,
Wow.
wow, I'll be super rare when I come. And it's since I've trained, I mean, it's a parent. There has been a lot more women, but at the time I thought, that, well, I'll be special, and so I like that idea of it. But for sure, there are things, in speaking up, you become a lightning rod. And I know I'm not always. I don't always present. I'm not the most diplomatic, so to speak. I mean, I definitely could present things in a kinder way, and I probably do, don't always sit and think things through before I just spew my thoughts out there. So I do think I do become a little bit of a lightning rod because I tend to speak my mind before I think. But there was a time when I I was going to quit. Actually, I right after um, around I was pregnant with my second, and I was at a low in my career, and I was like, I just can't do this. This brings me no joy right now.
Mm-hmm. Right.
I'm not, I don't like this. I don't feel supported. I feel, I'm pregnant again. This would be a good time. When this baby comes, I'm gonna take time off and just reassess. And so I had planned it out from the time I was going to announce that I was going to quit so I had this whole plan, like, I'm going to announce I'm pregnant on this day. I'm going to announce that I'm going to quit on this day. And
Mm-hmm.
then, and so I had this whole plan of how I was going to quit. But then, and everything seemed to fall in place. I announced that I was pregnant. But the day after I announced I was pregnant, I miscarried.
Oh,
And so that, and I was pretty far along. I was, 15 weeks along.
wow.
And it was so emotionally devastating. It was actually really helpful to work at the time
Yeah.
because it completely took my mind off of it. It like made me, at that point, I really appreciated just being at work, seeing patients, seeing other, like being able to help people. Like
Mm-hmm.
it gave you like a different sense of purpose. Like you could
Right.
still do and take your mind off of just being sad.
Yeah. And the
And
loss.
so I think at that point I was like, okay, I really appreciate that I could keep doing this, and that like made me feel whole again at that
Yeah.
time.
Yeah.
So um so then here we are.
And here we are. So, if there are women that want to similarly go into urology, or even women who have an idea and want to be an entrepreneur because they just have thought of a good solution for
Mhm.
something, what kind of advice do you have coming at this from both a urologist and an entrepreneur's perspective? What one piece of advice would you give to these women?
I think I think well, I think it's hard from both ways. I remember being a chief, and my urology first year, I had a female first year, and I remember she just had a really bad day. And I remember she came in the clinic and she was in tears because she just had this terrible day. And I remember looking at her, and I remember like playing through my mind like all the years of, all the years after that point in my life that still has not happened to her yet.
Yeah.
And I remember thinking, oh dear, like it sucks and it's going to get worse, but you are strong enough. You can do this,
Hmm.
and you are strong enough, and you will get to the other side of this. And it does get better.
Hmm.
No matter how bad it is, there are always points, no matter how bad anything gets, it could always be worse. And it always gets better as well. And
Right.
so like if you could just put one foot in front of the other, like there's almost no quagmire you can't get out of. And then from an entrepreneurial perspective, I think I'm so early on in this phase. I do think it's, very interesting because, fe- companies of female founder are funded at a much lower rate than,
Hmm.
males. I mean, if you look at all these companies that have unicorn status, like WeWork, what do they do, right? But they just have these men that give these really great talks, and so they get all sorts of promotion. And I'm sure there are the number of female companies that pitch and actually get funded are so much fewer. Um, so I guess so far, it's just I like the process of it all. Um, I feel like I don't know if it's being, when you listen to all these entrepreneurs on like how I built this and things, and they always say, well, I didn't quit. And so it's like, well, is it because you were so smart that you knew it and you were so strong and you persevered, or you were so stupid that you didn't know that this was like your chance was 1 in 1 million and you won the lotto on it? And so I do think that determination has paid off in the sense that I feel like I am very lucky at this point in my life because had I tried to do this underwear company in residency, there was no way I would have gotten this far. Um, there was so much money that I had to put into it up front, and I failed so many times. I would try one factory, try prototypes, and it would fail, and then try another one, try prototypes, and failed. Um, if I were a resident, like I would have been able to do that one time.
Yeah, that's true.
Like
Yeah.
lucky I'm in a point in my life where it's like, well, husband, are you okay if we try one more time? Because I think this one shows promise. So I guess it's and I finally found the right factory, found the right partners in this, And I don't feel like that would have happened if I had quit. And, there's nowhere along that line that there was no indication that the right factory was ever going to show up. So I do think, so I did put some bright lines in for myself. Like, I won't spend more than X amount. There is going to be a limit to what I'm going to put in. But until that time, I'm going to try my darn hardest and try not to let this really, try not to let the disappointments, discourage me, and keep tracking on. Because through this process, it does feel like you take one step forward, two steps back, one step forward, two steps back, and it still feels that way. I was so excited last week because my factory told me that they were done with the manufacturing. They had all my underwear ready, and it was going to be ready to ship next week. And so I had my logistics guy set up. He was going to go there, pick it up, and then, I'd have it I'd have all my inventory the following week. Well, thanks COVID, the flights from, so my factory is in China. The flights have been cut down so dramatically. The costs have gone up 10 times just to ship over here. And then, because there's so few flights from China to the US, there's no guarantee. They have no idea when they could even get it on a flight. So they said it'll be more reliable and cheaper via sea, just to ship
put it on a boat.
To put it on a boat. So here we are.
That takes a while, but it'll get here.
Hopefully, as long as they don't close the ports on us.
Slow and steady.
But it's like that at every step. Every time you feel like you've gotten it, there's something else. And it'll be random things like, oh, I've got everything. I've got my box right. I got this that I like. And then, where are your barcodes? It's like, oh, I need to buy barcodes. Okay. How do I buy barcodes? And
Google.
I know, yeah. And then you're like, oh, damn it, one more thing. Yeah. But there's so many like little regulations that you don't know along the way, and it's like, oh man, I need to have a barcode per size, per color, per style. Okay. That's a lot of barcodes.
Well, I mean, it's been really cool to kind of be an observer alongside you as you've gone through this process, and and I think as
do hear all my up and downs.
As a friend, I get to hear about all the ups and downs, and I think just to keep going is determination. It's like having that grit, and it's kind of remembering why you did it in the first place. I think it takes all of that to keep going.
I think
so. I think our listeners, I'm sure, will be excited to see the product and your pride and joy, the pee catcher, right? And so I would like to make sure that they know where to find you and your company, and tell us. We haven't even said it yet. Tell us the name of the company.
It's called ONDRwear.
And how do you spell that?
ONDR. And so the website is www.ondrwear.com.
And are you on social media as well?
I have an Instagram at ONDRwear. And I think that'd be the easiest one. The rest of the social media is still being fleshed out a little bit more. There's a Facebook page. Also at ONDRwear.
Perfect. Cool. I learned a lot today, even as a friend and talking to you. It's just, it was a wonderful, wonderful talk. And I think our listeners will enjoy this podcast as well. So thank you again for being on with me today.
Thanks for having me. I hope that it was interesting, and it's been fun for me. Thanks.
Thank you.
Bye.
All right.